some in some of the different counties that Partners covers. So we have a poll that just went up. If you wouldn't mind answering that, just to give us an idea of what best describes your role. And then I'm going to turn it over to Abby. We do have interpretation services for this cafe, and just to let her explain a little bit more about that.
Yeah, Robert, they're actually trying to get connected now. So if you could give me just another minute or two, they're having just an issue getting connected. But we will have a Spanish interpretation available, and once it's on, it will flash up at the bottom and you can select the language of your preference.
Thank you, Abby. Well, since we're waiting on that, we'll go ahead and just introduce our Community Cafe team. I am Robert Anderson. I'm the Community Engagement Specialist with Cabarrus County. And then I'll turn it over to the other folks on our team.
I'm Katie Barnado. I'm the Regional Director of Community Operations for Burke, Rutherford, and Catawba.
And I'm Jeannie Patterson. I'm one of the System of Care Community Training Coordinators.
I'm Amber Matthews. I'm one of the other System of Care Community Training Coordinators.
And I'm Stephanie Sunderberg, and I'm yet another System of Care Community Trainer.
I am LaQuisha Martin-Hillian, and I am the QP for the Geriatric Adult Specialty Team with Stanley, Cabarrus, Union, Forsyth, and Davie County.
Good morning, guys.
Good morning. My name is Scott Riley. I'm the District Attorney for Burke, Caldwell, and Catawba County.
I'm Stephanie Robbins. I am System of Care Community Trainer. I work with Forsyth and Davie County.
Good morning, Jerry Campbell, Community Engagement Specialist for the North Region, Surrey, Yadkin, and Iredell.
I'm Carolina Bello, and I'm one of the supervisors with Access to Care, the crisis line, all other counties.
Thank you. And then just a little housekeeping. We do have Amber who's monitoring, Amber and Katie monitoring the chat. So if there's any questions that come up during the presentations, feel free to put a question in there, or once the presenter finishes presenting, feel free to ask a question. We want this to just be laid back, casual conversation, just learn as much as we can from each other. We all have different experiences. And then I don't want to start until we have that interpreter set up. Abby, are we ready to go?
They are, because I'm on the phone with them. She's trying to connect right now, but she is on the West Coast, so I'm not sure what the issue is. If you need to get started, I can go ahead and just set it up so it becomes available as soon as they're connected. And we can pick up and go from there.
Okay, that's fine. So our first speaker this morning is Stella Bailey. She is from DHS here in North Carolina. So I will turn it over to you, Stella.
Thank you so much. And thank you for inviting me to the Community Cafe today. So my name is Stella Bailey. I'm the Section Chief for the Justice Systems Innovation Section. That's part of the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. And our section works specifically across all the intercepts where someone with behavioral health needs may encounter law enforcement. And our objective is to ensure that strategically and operationally, we have systems in place where the needs of these individuals can be identified and appropriate action taken to ensure that they have access to treatment. And sometimes that happens at different points. So it can be diversion, it can be assessment and treatment in jails and booking. And then as someone progresses through the pathway, we're working to ensure that accessibility to high-level treatment is available. But today I'm here to talk about diversion. Diversion is a particular area of interest to me particularly, And this is when we talk about that, what we're talking about is identifying the needs of someone at the earliest opportunity, and particularly if it is a low-level crime or misdemeanor, that they are diverted rather than being going through into the justice system, that they are provided with access to appropriate treatment. So one particular and successful program is the LEAD, which is Law Enforcement Assisted Diversion. And this is a set of programs and policies and philosophies that provide law enforcement officers with the skills and knowledge to identify when it would be more appropriate to have someone access treatment rather than being arrested and booked and going into the justice system. So LEAD has been successfully implemented in different stages across this state. NC harm reduction is a particular leader in this area for North Carolina. And we know that it's, and it looks different and in different areas. And one of the reasons for that is that this is very much a community-led program. This is about working strategically across and in partnerships across law enforcement, treatment agencies, MCOs, community partners, to ensure that all of the pathways are in place to assist law enforcement officers to make those decisions. In particular, we do fund some of these programs. Our most recent funding opportunities have closed, but that should not deter anyone from starting to work now to pull together successful programs. We do advertise when we do have grant funding available. However, that funding tends to be about a year to 2 years in length because of it's typically federal funding grants that we're able to get and pass through. So the more what we're leaning towards is really that capacity building part of working with communities, providing information on how to go about pulling these programs together, what you might need. We'll soon be starting our Stepping Up initiative again and sequential intercept mapping training. And we have more opportunities in addition to funding to support communities to do this. We also want to raise another funding opportunity, which DHHS in particular is advertising, and that's the opioid settlement money. If you put into your search engines, NC opioid settlements, that will take you to the state's opioid settlement page, and that gives a number of guidance and recommendations on what local communities and counties can do with the funding available to them that's going directly to counties. And that includes early diversion programs. And over time, you'll start seeing more and more resources come up there as we pull together different packages with input from all of you on what you really need to see from us and how we can support you. So that is the end of my talk, unless you want, does anyone have any questions?
Hey, Stella, I'm curious about the sequential intercept mapping. Like, how does that work?
Can I just pause for a second? I'm sorry, I am so sorry to interrupt you, but I do want to make sure that everyone knows that the interpretation feature is now enabled and our interpreter is with us. So if you would like to select Spanish, it is now available. Maria, do you have any questions for us? Are you connected? Everything good? Oh, she's on the Spanish side. It's just simultaneous interpretation. Okay, let me send that to you. Okay, Stella, I'm sorry.
That is absolutely fine. It's important to make sure that we have that up and running for folks. So sequential intercept mapping is a fairly in-depth process where counties and communities are supported to come together and map out those pathways where someone with behavioral health needs intercept with law enforcement and the criminal justice system, and what how it happens and where there are opportunities for identifying needs and supporting access to treatment. It is about mapping out your own local areas, getting to know each other, getting to know who to call, who to work with, and how your particular communities work together. And it's different in every single county. It's going to be very different for a rural county compared to some of our bigger urban areas. And so we are building up our own capacity at state level to support our communities to do that. So it has been done before. We have had individuals go out and support communities, but we have taken a pause during the pandemic. We, like everyone else, have had a few of those staffing issues and attrition issues, but we're coming back up to speed, and we will be supporting this effort much more consistently in future.
Thank you, Stella. I did have a question, because it sounds like you really do tailor your resources to whatever the community needs. If a certain community is looking at setting up a diversion program or a LEAD program, do they contact you directly to get that going?
Yes, they can contact us directly. The best contact is we have a support email address. It's dmh.justice@dhhs.nc.gov. And that goes to our diversion and reentry team. They're supporting a number of individuals now who have grants with us, but they also will support anyone with any community with any TA needs, questions about how to go about setting up any of these programs.
So if we have a county that's looking at starting up a LEAD program, would they need to, what would the planning process look like for them?
I would start with doing a bit of your own community mapping, like reaching out, making connections with local law enforcement agencies, the sheriff's office, the local attorney and court system. And that is your basis of any successful diversion program, is knowing who all of your community partners are. Understanding people's needs, understanding people's perceptions of what is a low-level sort of misdemeanor, what constitutes a need for, so how do you assess that need, what level of training is available. A lot of our counties have crisis intervention team in their law enforcement. This is different. Law enforcement assistant diversion is not at the crisis point. It's identifying need before someone is in crisis. But certainly a lot of, with that training, a lot of knowledge of the local mental health and substance use treatment services are part of that. So reaching out, getting a strategic, collaborative objective for what your diversion program should look like is your first step. And next step is through that collaborative process, what's next? Is the need really to have perhaps like a community navigator based in a law enforcement agency that can support law enforcement officers? Is it engaging with a particular type of treatment agency to support that, or are there other ways of performing this work? So those are your basic foundational pieces, and I can't stress enough that importance of that collaborative engagement and really coming to a consensus across your different agencies about what this is going to look like and how best to move forward.
Thank you, Stella. That's an awesome resource to have for the different communities. Again, just knowing that you're going to tailor what they need to what they want. And so that's just an awesome resource. Katie did put the email address in the chat, and Jeannie also posted a link to the dashboard, a substance use action plan dashboard. So if anyone wants to take a look at that. Do we have any other questions before we move on to our next presenter?
Thank you, Stella.
Thank you.
Okay, if not, then I will introduce Khalil Nassar with PQA Healthcare, and I'll turn it over to him.
I think it should be Kathy first. Then I will be next. I think my understanding, Kathy's going to start first and I will be next.
We can do it that way. It was just on our agenda that you were second.
Yeah, Kathy, go ahead and start and I will finish. Yeah.
Okay, so I'll introduce Kathy Perkins. She's with Partners.
Thank you so much.
Hi, good morning, everybody. Khalil could tell you everything I'm going to say anyway, but I'm happy to have this opportunity to speak to all of you. I am the project director at Partners for the MAP program, which stands for Mental Health Assistance Program. The MAP program came out of a 5-year SAMHSA-funded jail diversion grant. So our program is a jail diversion program. We are located in Iredell and Surrey and are now reaching out to Yadkin County. We work closely in conjunction with PQA Healthcare. They are our provider of our services in the community. So that's why Khalil knows as much as I do, much more probably, about how our program works. But what it is, it's similar to the LEAD program in that we offer an alternative to law enforcement officers who come in contact with those with mental health and or co-occurring substance use disorders who may recognize that this person would not benefit from jail or a trip to the emergency department, but rather their needs could be addressed more effectively in the community. So we provide that linkage to services, and Khalil can talk more about how that will work. And that we also provide, which I think is one of the most important factors of our program, is that we provide community case management for up to 12 months. Our program is staffed with certified peer support specialists doing the connectivity to linkage to services, working with the individual, working with the family. I mean, they go above and beyond in every single situation to ensure that they've done everything possible to improve the quality of life for the individuals that come into our program. We have a few exclusions based on federal guidelines, which would keep someone out of the program initially, which are having a blood alcohol level over 0.3, are physically out of control, or who have an emergent medical need that would involve, medical care at that moment. However, once those three or any of those issues are resolved, we're more than happy to begin working with them and to ensure that they get what they need and they have the follow-up that will help to make them successful. And we work, as Stella was talking about, in a very collaborative manner with our whole community. Of course, our initial contact to the program is through law enforcement, because it is a law enforcement diversion program. So that's what the first contact has to be. However, we can be in touch with that individual once we receive a call on basic contact information within 24 to 36 hours of contact, but usually it's much sooner than that. So we're really proud of our program. We think that it's served a very vital purpose in addressing the needs of those who are seriously mental ill and have co-occurring substance use issues, in helping them to be validated as human beings and to get their lives back on track. And so I'm going to turn it over now to Khalil so he can give you more of the nuts and bolts of how the process works. And also, well, I'll let Khalil tell you about the award. Okay, thanks very much.
Thank you, Kathy. Good morning, guys. First, thank you so much for inviting me to this cafe. And and I'm excited to explain to you briefly about the MHIP program. As Kathy said, first, our program building compassion. Every person on the team, they just caring individuals about the community and meeting the needs of the community. That's number one priority in our program. The MHIP program, as Kathy said, we provide a menu for the law enforcement to meet their needs, to make sure to help those individuals in the community who does not belong to jail, who does not belong to the inpatient units, and they need intensive community services. And when I say intensive, we provide intensive case management. And I'm going to give you examples how our process works. But before I do that, also, Kathy, you mentioned something about the law enforcement. Also, we do collaboration with Davie Hospital, the Delta unit, and also Huge Adam Hospital. And also we reached out to Northern Hospital of Surrey. If any individual come to ED via the law enforcement, we'd be glad to get the refer and help them as well under the MHIP program. When we get the call, and Kathy, you said it's 24 to 36 hours. Actually, our peer support, they contact the person immediately. And because there's a value in having immediate contact with the families. But if we get the refer from the law enforcement, sometimes we meet them on site. Because actually, like with Mount Airy, since we started in May, 90% of our refers were our peer support was on site assisting the law enforcement and the members. So they meet that person and they will start doing an assessment to evaluate what the needs are. The majority of our individuals we serve, they have housing issues. They need linked to treatment. If they are connected to, if they already in treatment and they are not engaging in treatment, we are able to connect them and engage them to go back to their treatment or find other alternative treatment to help them with their recovery, with their medication, with their housing. I believe strongly in bringing real examples about the program. Let me give you an example. Like, for example, yesterday we got a phone call. A gentleman was wandering around DSS in Surrey County. He left jail, DSS, and they need help with that individual. Our peer support was there. They assist them with their needs, what they need. I think they needed assistance with Social Security. They were in jail and their Social Security disability discontinued, and they were outraged because they need their check. So the peer support was able to help that individual to connect to Social Security. Also, one of the major pieces of our program, we provide that transportation always, guys, is a barrier. We are willing to transport individuals to any treatment center in the state if they're willing to go to treatment. And Kathy mentioned, I know that our MHIP program is primarily for mental health, but sometimes we get what's called dual diagnosis, substance abuse with mental health, and individuals, they need to be engaged in outpatient treatment for substance abuse. And we really have very, very, very successful stories. We were able to assist people in treatment, build family relationships, gain employment, obtain employment, have stable housing, and it's been a great success. And I think I look at our team as immediate mobile crisis team because it's really works very effectively. And it's not about just like helping the people. We are showing data that the program is working. We have monthly meetings, weekly meetings, we collect data, we evaluate the program as we go because we're going to make sure we have reduction in hospitalization, reduction in legal involvement, stable housing, and we also focus primarily in social determinant of health aspects like stable housing, employment, insurance, having food at the table, medication, treatment, and it's a very comprehensive menu provided by our MHAP program. And I can talk for years about the success and the progress we make in people's lives. And one thing I want you to know that it doesn't matter if you have insurance, if you don't have insurance, if any person meets the criteria for this program, we are willing to assist that person. And also, it's a person-centered program, guys. It's not like we force treatment. It's a person-centered program. And that's why we see the value in the peer support. The peer support, they were able to connect to those individuals. They will listen to them more than anyone else. And I see why we need to expand to other counties, because we have a great success in Ardell County, we have a great success in Surrey County, and we are moving also to Yadkin County. Just remember, our program is comprehensive intensive case management. And we follow that individual for 12 months. And guys, this is a long term. It's 12 months, it can be a long time. And also, if my understanding, if the 12 months is over and that person has another encounter, they can start over in the program. And again, just one of the things is, like, I appreciate the collaboration between partners. Kathy's been great as a project manager, Dr. Wabi helping us with the data, Jeff Eads with the community engagement with the law enforcement in the community. Like, for example, we met last week, Kathy, with Yadkin County manager to present the program to them. And we had great outcomes from that meeting. I think that's the MHAP program. If you have any question for me, I'd be more than glad to answer you.
There was a question in the chat. I'll read it. It says, I get calls every day now from men who are needing shelter, but also from concerned citizens trying to help until the shelter opens. And most of these men are dual diagnosis. How do I refer to your program to assess if you can help them get into your services?
I think, as Kathy said, our program, we have to get the referral from the law enforcement. If they have any encounter with the law enforcement in Mount Airy Police, Ardell Police, even the Sheriff Department, we will get the referral from the police department, and we'll be glad to contact them immediately to meet their needs. And honestly, just housing, and I see that why the question, housing is a big need in some counties. Just it has to be a law enforcement referral. And honestly, it doesn't have to be arrest or something. Sometimes if they have encountered by phone by the law enforcement, the law enforcement officer can pick up the phone and call us, this person needs some help with house, and they can give us the name. So we don't have a lot of bureaucracy in the program. So, because our goal is to help the people immediately.
So I have a question, Khalil. So I was a social worker for 13 years in family medicine, and we saw that a lot in regards to social determinants, everything centered around the different needs, and people didn't quite put that together. If someone has no housing or lack of food, that placed a tremendous impact on them and their overall well-being. But wanted to see how in the older population, how that looks with individuals who are 65 and older in regards to your services, or have you kind of thought about it in that way?
Honestly, first, the program doesn't have an age. It has to be adult 18 and up. There is no age limit. And actually, to your point, I think we served individuals above 65-year-old in this program. And actually, when we started in Ardell County, we encountered a lot of we had encounter with a lot of homeless population, and we were able to help those individuals maintain housing, and even just give them basic life domain. So, like, for example, to your point, I think I concerned about senior citizens. Sometimes they can be more at risk for medical and health issues. And that's why we give them really priority. I'm gonna give you an example. We had the homelessness collaborative last month, and Kathy was on that call. There was a gentleman, he left the prison. I think he stayed in prison probably more than 5 years. And he's an elderly guy, and he's in a wheelchair. So everybody came together to find resources for that individual to make sure he's not going to be in the street, you know, food and shelter and the treatment he needs. So yes, if somebody 65 and we serve them unlike anyone else, and we give them priority as well. And I forgot to mention that in December, we, PQ and partners, we were awarded the Innovation Award for the MAPA program in Pinehurst. I think that's after the hard work from everybody and the law enforcement and staff and partners, everybody. And I want to say congratulations.
That's awesome. Khalil, I did have one question. For those folks that may slip through like law enforcement, if they end up on probation or parole, can they refer to you as well?
Yes, sir. As long as they have encounter with the law enforcement, yes. And to your point, actually, we are reaching out to the probation officers, the leadership to introduce our program to them. And we serve the individuals under the probation under the county MAP program. Because it's all connected. If they violate their probation, they're going to have the encounter and the arrest, and that's why when we come in and assist. And honestly, we serve the individual to help them to pay their fine, to find employment, because if they don't pay their fine, they're going to end up violating their probation and they're going to go back to jail. And some of them have families, so it's a great program to assist those members.
Yeah, one thing to remember with parole and probation, and Khalil said it, but if they're coming out of jail and they've got their parole and probation officer in place and linked to services, that's great. If they violate, that's when we can get involved, because that would be a diversion back to jail, not a prevention. So it's tricky, and I sound like, this rule queen here, but the federal government is really clear on what diversion is.
Yes.
So, but we're more than happy, and we've worked with many clients from parole and probation for that very reason, because they were in danger of being violated and going back to jail. So, and we work with any county we're in, we would love to work with parole and probation as well. So, and I know that parole and probation takes advantage of CIT training also, so that's really good. So it all kind of fits together, because the CIT training is one of our evidence-based models that we utilize with regard to our grant program. But thank you for that question. That's a good one.
And Kathy, I want to add one thing. I think I like the innovation about our program. Like we go beyond the circle within the guidelines of the program with SAMHSA grant, just to help the individuals. And honestly, even when it comes to hygiene, finding clothes, finding food, and our peer support, they work very aggressively to help those individuals. There's no limitations for it, and that's what the unique about our program. Mm-hmm. And me as a leadership from PQ, we believe in that program, because I do believe many individuals in our community, they don't belong to jail, guys. They don't belong even to the inpatient unit. They need basic help, and that basic help, sometimes 1 hour, it takes them a long way. And also, don't forget, there is a saving cost in the system as well. If they have the appropriate services, will be saving cost in the system as well. And that's what our program do. And again, please don't forget, if they don't have Medicare, it doesn't matter. If they have an encounter, we'd be glad to help, regardless of if the insurance or not.
We had one more question in the chat. Do you have a website that folks could go to just to get more information about the program?
I think we did not. I think because it's collaborative with partners, we'd be glad to add it in our, I can talk to partners if they allow us to add it to our website. I'm not sure, but if they can go to, I think, Kat, is it posted on the partners website, correct? That's my understanding. Is that right?
I think that it is. We can double check, and we had actually talked about that, but quite honestly, COVID pushed all of us back on doing things. And so we were kind of hanging on by our fingernails there during COVID to be sure the program kept going. And so other things kind of fell by the wayside, but that is a good idea. We can certainly work to get, some information up wherever it could be seen, most readily.
And I think, Kathy, one thing, sometimes we need to be cautious about this sometimes because, like, for example, one of the cards went in the hand of somebody, a person, they start calling directly without having engagement with encounter with the law enforcement.
Yeah, yeah.
Yes, we're able to help them, but I think a lot of members, they misunderstood the protocol of the program. You have to have an encounter with the law enforcement. And I think that's the only
right. Yeah, it's not kind of a refer yourself type program.
Yes, it's not a
but interestingly enough, and I know we're probably going over time wise, but we received a call from a father who learned about our program from NAMI in Boston. Yes. Now, that was like, because I asked the dad, I said, how did you even hear about us? He said, well, anyway, he tracked us down through NAMI in Boston. So I thought that was interesting how information gets shared, but he got to the right place and his son's now involved in the program. And, and we're very grateful that he was able to reach out to us and we could provide some assistance. But anyway, but yeah, that's a good point, Khalil, because it's not a pick up the phone and call us directly.
And to your point, even that case, that father, he was contacted. We contacted him the same night after hours just to ensure that we are here and we'll be glad to help. And that meant a lot to that father,
No, I know he was cute. He said, so would I be expecting, I explained the program to him. He said, well, would I be getting a call in like 2 weeks? And I said, no, probably by this evening.
Yeah, he did,
so
yes.
That just speaks to the fact that we want to get involved and start assisting when people are most in need and most willing really to hear about interventions.
So that kind of brought me to my question. We deal a lot with the mobile crisis units as a crisis line. So if we would have somebody that qualifies for the program, but we're engaged with a crisis, mobile crisis, will continue with that protocol.
I think, okay, go ahead. Kathy, you answer that one? Hello?
Yeah, hi, I'm okay. Yeah, you would, if you're involved and have mobile crisis on the line, stay with that because they will give you an assessment. Again, if they're involved with law enforcement, and I know law enforcement is involved in a lot of calls that involve mobile crisis as well, but they could be aware of it and they could be asked to get in touch with us if it's a situation, because Pam Navy's on the call, I think. Pam is very involved with our program and officers contact her a lot in Iredell County about referring to the MAP program because they are involved and recognize that the program might be of benefit to the individual. Yeah, if you've got mobile crisis on the line, go with that. And because we're more of a mobile support team because we do an outreach model as our, model. We try to having officers bring individuals to us, but we found it's much more effective to be available to the community to go to them. So.
And Kathy, I had raised my hand. If you don't mind, this is Pam Navy. I want to interject, guys. These folks say what they do and do what they say. We love the work. I just want to give you a little snippet of what Khalil talked about of the one gentleman that came out before he went into prison almost 6 years ago. He was on disability. Coming out of prison, he's coming out homeless, confined to a wheelchair with past substance use disorder and mental health issues, homeless to this community. This is his community of where he was convicted, and probation is just throwing their hands up about this situation. And I cannot tell you, applaud this program enough for coming on site, for arranging psychological, for helping lodging come through, for follow-up with their peer support with this man. And that's just one case. And another one that means a lot to me is Jim Dobson, who's the peer support that I work with here in Iredell. Jim had contacted myself and one of our partners in our homelessness collaborative about a lady that came to the hospital as law enforcement referred, but was being released, and she was being released homeless. She was a veteran of the United States military. And Jim said, he said, well, I just wanted to reach out. And that's what I applaud him for, guys. This program is not, hey, it's a new program. It's a program that works with existing resources and says, how can we better serve these people in the community? And Jim was great, and he reached out to two of us. And before the end of the day, we had her on her way to the Veterans Hospital for continued services. And for the Veterans Services through one of their facilities where they allow people to stay and follow up with their treatment and things like that, of transitional home, but it's out of this county. So I just want to applaud the efforts. I love this grant. I know it's taken it a while to get to where I think, things are rolling great. And, thank you, Khalil. Thank you, Kathy. Thanks to partners for doing this. And hey, you're a great resource. I've got you guys on speed dial. You know it.
Thank you, Kathy. Thank you.
Thank you, Pam.
You're a great partner too, Pam. Thank you.
Thank you for sharing. If anyone else has any kind of questions for Kathy or Khalil, we did put their contact information in the chat, so feel free to email them or give them a call if you want to learn more about their program.
Thank you, guys.
So again, thank you. So now we will turn it over to Scott Riley, who's the DA in Catawba, Burke, and Caldwell counties.
Sorry about that. I couldn't find my unmute button. Yes, good morning to everyone. Thank you very much for having me, allowing me to talk about the LEAD program in our district. My name is Scott Riley. I am the elected district attorney in Burke, Caldwell, and Catawba County. I've had a unique path to getting to be the district attorney. My first job out of law school 34 years ago was as an assistant DA. And my marching orders when I was assigned to district court was to prosecute low-level felonies, substance abuse cases, possession of drug paraphernalias, possession of meth, possession of marijuana. And for the next year, I prosecuted those cases. We didn't really have any programs for people to go into as far as diversion programs. And it was very frustrating because I would see the same people week after week, month after month. Nobody was really getting any better. I was making no difference. No changes were occurring. I just remember being very, very frustrated with my job as far as not making a difference. Then I became a defense attorney. I was a defense attorney for the next 25 years, and I saw a different perspective when my clients would come in, so many with substance abuse disorders, charged with low-level misdemeanors, shoplifting. Didn't matter what they were charged with. Usually, the common denominator or their underlying problem was a substance abuse disorder, and I started seeing different things that I didn't see at the district attorney's office, such as the stresses, the problems that they had when they came to see me, when I was talking to them face to face. And I remember saying a number of times, boy, if I was a district attorney, I think I would try to handle these cases differently. I think I could handle things differently and make a difference in these people's lives, because it's doing no good to send them to prison. They lose their jobs, they get out of prison, and they're stuck, and it would just perpetuate itself over and over and over again. And usually the ones that were suffering the most were their children. And I can make a prediction. I know exactly what's going to happen to these children. They're going to be charged, and they were charged. I've seen the children and the grandchildren became my clients over the next 25 years. So when I ran for district attorney, I ran on changing things around in the district attorney's office, in that I would move more to instead of prosecution and jail and convictions, I'd be moving towards a rehabilitation and treatment. I had no desire whatsoever to put people in jail or get a conviction if I could make a difference, if somebody could get off of drugs and become a more productive member of society and be a better parent, be a better spouse, be more employable. So I ran on implementing a number of diversion programs when I became district attorney. 9096s, conditional discharge, deferred prosecutions, really anything I could do to make an incentive so that if people would successfully complete a treatment program, I was certainly willing to dismiss the charges against them. The main disadvantage of this is even if we're willing to dismiss a charge upon successful completion of a treatment program, it takes a number of months before that person gets into court, before we actually dispose of the case. And quite frequently, by that time, the person's already lost their job, they couldn't make bond, or they've committed other offenses, other drug offenses before we actually got into court and got them into programs. So just before I took office in 2019, Thurman Wisnett, who is our chief of police in Hickory, called me into his office and educated me about the LEAD program, which had just been started in Catawba County. The main difference about the LEAD program is it is a pre-charge diversion program. All the other programs I just talked about occur after somebody is charged. The LEAD program is a pre-charge diversion program, and I think that's the most important thing. I give great weight and discretion to law enforcement officers to make the decision as to who would benefit from the LEAD program. And the main difference between this program and the other ones I just spoke about was immediately upon contact with the law enforcement officer, that law enforcement officer can identify this person as could benefit from a substance abuse program, can contact our providers, and we have the mobile person. They have a handoff. It's not here, take this number and call in 2 weeks. I mean, they are handed off immediately, and if they're willing to go into the program, then they will begin treatment immediately. And I think that's the biggest difference between the LEAD program and all these other diversion programs that I've talked about that we still have. And anyway, they're handed off immediately. I give great discretion to the law enforcement officers they're the ones that have the interaction. They're the ones that know these people that come into contact with them over and over and over again. So it's just not for low-level drug offenses. We allow the LEAD program for shoplifting, larcenies, other misdemeanors, and including low-level felonies, usually possession charges that are class H and I felonies. The only kind of strong sticking point I have as far as ineligibility would be where somebody is selling drugs or giving drugs to other people. This program is for people that have substance abuse disorders that are users of drugs, and we feel that they would benefit and get off. I've been very happy with the LEAD program. Unfortunately, in 2020, the numbers really dropped off because we had no court. We had shelter in place, and the numbers just went off. But I am very hopeful that that's going to all pick up. If anything, I was really expecting a lot more of our calendars to decrease in size because of this. I really can't say we've had that much of a decrease in size. I wish our law enforcement officers would use this, the LEAD program, more. I don't know if it's because the law enforcement hasn't bought into it as much, or if it's difficult to get people to be willing to actually go to treatment immediately. And that sometimes that can be difficult to convince somebody that they need to go right then. So I wish it was used more. We do have accountability every month. We go through every single person that's in the program. If they successfully complete it or do what they say they're never charged. If they don't, then I want to make sure that they are charged so that it's just not some bluff. And so we do have accountability and meet every single month and go through every single person and how they're doing. And we have representatives from every agency that sit in on those meetings. So I'd be glad to answer any questions. I've been very happy with our LEAD program. I'm happy to see that other counties are getting involved as well. We had a meeting yesterday, the day before, with Gaston County. I think they're going to implement a LEAD program in the very near future.
Thank you, Scott. I did have a question. Going back to law enforcement, not necessarily buying into the program, do you think that's because they feel there's not that accountability piece, that, or they don't know that it's there, that these people are still going to end up getting charged if they don't follow through?
I'm not sure what it is. I do think law enforcement has initially have a problem with saying somebody that's using drugs that's committing a crime and putting them into treatment instead of arresting that person. I do think there is a buy-in period. I think I think our law enforcement, heads of law enforcement, are doing a good job of educating their officers that this is a good program, that you cannot arrest your way out of the drug problem that we have. We could have calendars of 1,000 every single day if we wanted. That's not going to change anything. It's not going to make anybody better. And that's why I tried to talk about my experiences as a district attorney or as an assistant district attorney years ago. I didn't make a difference. We're not going to make a difference just by arresting everybody that's using drugs. And that's the benefit of the LEAD program.
Yeah, that's kind of, I guess, what I was getting to is you can't arrest everyone to solve a problem that's substance abuse related. Does anyone else have any questions or comments for Scott?
Thank you, Scott.
Oh, thank you. You're welcome.
I'm curious, Stella, if as we're looking at Catawba County in particular for not startup, but for capacity building, and if that's a barrier that's been identified, do you have any recommendations from the state about how to build capacity in Catawba based on the barriers that we're seeing there?
So the most important thing it's again, this is stakeholder engagement piece, and it's understanding from the law enforcement officers what that is what exactly is the barrier, because sometimes it's not what we think it is. Just going back to my own experience, this was doing similar work in England, where I was a public health strategist working in the substance use system. We had a call, and we're told about this particular incident where a police officer was called to a local hardware store because two people had been caught attempting to shoplift. And when the officers were there, they were still there in the manager's office waiting. The manager talked to the police officers and said, you know, we had to call you because it's part of our policy. But we see these people all the time. We know that they use drugs in our parking lot. We want them to have treatment. The officer, because he knew and had confidence in the treatment service, was able to, in this particular case, take them straight to the treatment center and deliver them, and said, and it was this case, you know, do you want to go to treatment? I can take you there. We can support you with it. They got to the treatment service and they were seen immediately, given cups of tea, nice hot English tea with lots of milk and sugar, and but yeah, treated with compassion and they got that assessment immediately. And one thing that came out of that, that I was told about this incident because that was an outcome. When we were working strategically across all of our partners, we agreed that we will know that we're getting successful in improving our system when a law enforcement officer uses his own or her own judgment to take someone into treatment rather than booking them and having them arrested and going through that process. So that happened. Everyone emailed me. We didn't believe you. We didn't think it happened. But it happened for a couple of reasons. And one of those reasons was that there was faith in and an improved recognition of the treatment services and their availability and their ability to be responsive at the time that the police officers needed them to be responsive. And what struck me with how Khalil and Kathy were talking about their program was the responsiveness, not just to those individuals at that time, but to members of the community. So they were able to, and that builds confidence in the community, and that feeds through to what our law enforcement officers understand of the system. And the other thing was that compassion that the people at the store showed. So like, no harm was done. We don't want to see individuals be arrested. We don't think, exactly to what Scott said, we cannot arrest our way through this problem. And so when you're thinking, I think when we're thinking about our police officers and what their barriers might be, it could be individual perceptions. It could be sort of understanding the responsiveness as a system. I think it's kind of, we put a lot of emphasis in listening to what everyone is saying is going to really help us do that. We have at the state level, emailing us, giving us a call. I've already made a note to contact Scott Riley independently after this to get his feedback on how this is working in Catawba, because what we want to design a few more toolkits and interventions to provide this type of work out into our counties and be more receptive to what everyone is seeing and feeling about our different services. Has that answered your question? I'm happy to answer anything more.
Thank you, Stella. So we're getting close to 11 o'clock, so I will turn it to LaQuisha to close us out. But again, thank you to all our speakers for taking time to join us and just sharing this valuable information. Again, their contact information is in the chat, so please feel free to reach out to them and utilize their resources. So LaQuisha.
Thank you, Robert. We want to say again, thank you to our panelists, Stella, Kalia, Kathy, and Scott, for enhancing our knowledge in regards to the lead in different and other programs within our community. We would like to invite you to come back. We would love to see your faces again for our April 27th Community Cafe discussion, which we will be discussing supporting individuals with intellectual disabilities. And that too will be at 10 o'clock. So we will say our goodbyes, but we want
LaQuisha.
you to. Yes,
I'm
ma'am.
sorry. I'm sorry, LaQuisha. I'm sorry. I got on late. My name is Jeanette Williamson, and I'm with Thaya CFAC.
Mm-hmm.
And I just want to share something right quick about a community event. I don't know if it's been shared, but I'm also serve on the board for Alamance County Community Services. And they have partnered with Guilford County to do an event, a giveaway, a pop-up event. And I just wanted to just share a little bit about it. That they're going to be doing giveaways, and it's going to be on April the 12th at the Four Seasons Mall in Greensboro. I do apologize. I thought the meeting was from 11 to 12. And that's a community event, and it's called the Big Pop-Up.
Okay.
And they're going to be giving out food and different things for bags for families, and they're trying to serve at least 2,000 people.
Okay, well, thank you so much for sharing that information. And again, we thank you all for joining us, and be safe, stay dry. Thank you.
Thank you so
Thank
much.
you. Sorry to interrupt you. Thank you.
Okay.
Have a wonderful day.
Bye-bye.